cat. We're going to do number 6. Build a first aid kit from The Outdoor Life, the Ultimate Survival Manual, Extreme Edition. And boy, I'm an RN and this really bothers me, and I'm going to explain why. But first off, how they explain this is build a first aid kit. If you're the type of person who's always asking for a bandage or an aspirin, it's time to get it together. Make a kit that includes the following. Now before we get into this, I just want to explain something. If you've got a first aid kit, the first question you need to ask yourself is what competency level do you have to use the material in the first aid kit? And it should be based upon probable needs. Okay? Very few people carry a first aid kit around with them when they go to work or back from work. I tend to do so because I use transit, but most people don't. But let's have a little look at this kit. I'm actually going to use 2 of my pre-made kits. One I use for kayaking and camping, and the other one is a small home kit. Now I do have a lot of other kits, but I'm just going to restrict it to those 2 portable kits because I think that's more what people are going to be interested in. So let's stay tuned and let's rip this to shreds. Okay, the very first problem with this kit is there's no actual instruction manual. The little tin kit, tiny little tin kit, put a first aid manual in it, it says. Okay, tiny little thing I guess. Though first aid's bigger than that, bigger than this, it's that big. No instructions in this whatsoever, and the stuffing is highly dubious. So it's okay. Let's get into it. The first thing they say is the catch-all aloe vera gel. Now I'm guessing they're putting this in for sunburn. You can suffer with sunburn. It's not a survival first aid kit item. I'm not really keen as a nurse on people putting jellies on wounds, whether it's sunburn or a trauma injury. But what I would use is something like this product. Now bear in mind that lidocaine can have adverse side consequences. It is a medication, but this is a very good effective topical painkiller, and I might consider something like this in a burns kit, though I probably wouldn't use this on a major burn, only a tiny little burn, and that's what I would use. I wouldn't actually put aloe vera in. So the kit is actually this, and stay tuned. So the next thing they tell you to do, which is fine, is scissors. Now this is the first time scissors have really appeared in this manual. Now I would argue, this is the horrific bit. You've got to be able to cut your toenails, right? Kitty could chew them off for me, but she won't. I can't reach my toes anymore. I can't chew them off. If you don't have scissors, you're not going to walk very far for very long. In, grit down. Have lots of scissors in various kits. But scissors is a good idea. This is just a pair of sterile ones. You don't need them to be sterile. Then we have non-adhesive dressing. Everybody's got these. Honestly, if you're bleeding, you'll go through a whack of these in like seconds. This would be minimal for a home kit. Okay, I don't really argue with that. Medical tape. Now medical tape comes in various forms and it's all quite expensive. There's lots and lots of types of it. This is basic paper tape. This won't last or adhere very long whatsoever. So what I recommend if you're going to buy tape is get tape like this. We call this Transpar. It used to be called Micropore. It's plastic. It's very sticky. And as you can see the difference in opening it, it will stick dressings to skin, which is what you actually need. This will stick dressings to skin, but honestly it sweats off and gets dirty very easily. You can see the difference in stickiness. So if you're going to get tape, get Micropore Transpar tape. Don't get the plastic brown tape. It's very bad on skin, very hard to get off, and its main use is to stick dressings to dressings and splinting and stuff like that. So you can get that, but get this. The other one they tell you to get is roller bandages. Now roller bandages they don't really explain, and they probably should. So these are roller bandages. It's just gauze in a wrap and you wrap it around. It is a sterile, they don't necessarily have to be sterile. The only thing that needs to be sterile is the part next to the wound. So when you have this, you can get your non-adhesive dressing, put it on and then secure it with this. These get dirty very quickly in a grid down situation. Keep them and wash them. What else do we have in our kit? Well, anti-inflammatory drugs. So there's a lot of stuff about that. I think they do have a place in small amounts in first aid kits. It can help out a little bit. It's not critical by any means. What I would recommend, unless you have liver failure from alcoholism or very young children, is aspirin. Now you don't need to buy baby aspirin for heart attacks. You just give half a 500 milligram tablet or a quarter of it if you're very nervous about what you're giving to the person because you don't know their medical history. But I would recommend aspirin. Now when you open aspirin and smell it, if it smells at all in any way of vinegar, this has now become a technical poison and you cannot use it. So you're going to have to revamp that regular. The other anti-inflammatory is ibuprofen. I don't recommend this. I find after about 2 to 3 years this stuff goes off. I do have some. It comes in useful for muscular injuries when I've hurt my back, I really want to slam it. So you might want to put some of them in, but again, change them out frequently. The number one anti-inflammatory that's pretty good is Tylenol. Tylenol pretty much never goes off. And again, if you've got liver problems, don't be taking Tylenol. But I would suggest Tylenol Extra Strength as your anti-inflammatory. It works just fine. When I have a fever, I will take aspirin and Tylenol, 1 to 2 tablets. 2 hours later I take this, 2 hours later I take more of this, and so on and so forth. That's what I do. Okay, now it says surgical scrub brush. I have a lot of gear. I have a ton of gear. I have wonderful gear. I have suture trays. I have sterile gowns so I can operate and chop your leg off. I do not have surgical scrub brushes, nor will I be getting a surgical scrub brush. The idea of surgical scrubbing, to scrub up for an OR in the field, is impossible. And the benefits from doing this, there are none, in my opinion. So no, this is not in this kit. Disinfectant towelettes. Okay. Alcohol pads, great for fire starting. The only use of these in first aid is to sterilize the skin prior to an injection. Therefore, I have no idea why they put them in this pack. What you need to do is get some wet wipes. This is an item everybody should have in every first aid kit. This one doesn't have safety pins. You don't need safety pins to put a triangular bandage on. You do need to know how to put a triangular bandage on. So if you have one of these, open up the packet and try it on. Get to figure out how to use it with and without safety pins. You can cause nerve damage and you can position the arm wrong, so a quick Google search will show you how to correctly put on a triangular bandage. So this first aid kit is from the sublime to the ridiculous with some good items in it, so I really don't recommend this kit. They say a rigid splint material. You don't need rigid splint material. Go to any second-hand store, find an old fairly firm but thin yoga mat, and using a knife make it nice and tidy. I didn't bother. Once you have this, when you do this with it and then use the roller bandage, you have a reasonable splint. You can also quadruple it and stuff like this. Now, one of the most common injuries you're going to get is fractured fingers and toes. You need to have little wooden splints there that you wrap around gauze pads with, so there's not too much pressure, and so you can actually tape the digit to other digits, and that's how you make your splint. But for legs and arms, something like this is fairly good. This is not strong enough, but when you do it this way, it's okay. It's going to remind you not to move the joint, okay? And when you splint, if the fracture's here, you need to splint up to here and here. If the fracture's here, you have to splint the whole arm, except for the wrist. In fact, I would actually splint the wrist as well because of movement. Elastic roller bandages, ace bandages, tensor bandages, call them what you will. They have little metal clips. These again can be washed and reused and reused and reused in grid down. These are absolutely essential kit. If you don't take anything in a first aid kit, take one of these. If you have a wrist or a ankle sprain in the field, by tightening this around it and making it immobile and reinforcing it, you can limp out of situations you otherwise cannot walk out of. So this is absolutely essential kit. Great they put this in. Great they put more than one in. But again, Make sure you know how to splint. Make sure you know about the form and function of the joints and the muscles and the connective tissue. Know what to do if you actually have a bad sprain, so you don't actually end up making things worse. Ah dear. First aid ointment. Antibiotic ointment. Prevents infection and aids healing. Absolute garbage. The amount of antibiotic in this will do nothing apart from increase antibiotic resistance in the general world, but we kind of use them for certain specific things in hospitals. Tracheostomies around here, because in case you inhale it, the little bit of antibiotic is less likely to cause a pneumonia. You really don't need this stuff. Kitty uses it all the time on cuts and scrapes for herself. I never use it. I don't like to put goob on. I just like to clean it, let it bleed a bit, and then let a scar come. But if you do get this stuff, bear in mind it's really expensive and it isn't magic. Good thorough cleaning without this is better than okay cleaning with this. Okay, a sterile compress. Now, let's be honest here. This could count as a sterile compress. If the packet is dry and there's no stainage on it and it's sealed, it's effectively sterile forever. It isn't really, but you know, in the field assume it is. This isn't, oh, that was Becky. This isn't going to, this is Becky again. This isn't going to do anything other than bleed through very quickly and be rubbish. So get a pad of them. Again, if you've ever seen a hemorrhage, if you've ever seen somebody bleeding, think how long this is actually going to last for in the field. It's not going to last that long, but you know, nice to have it. Now the other thing they say to get is tweezers. Now I didn't put any tweezers in this package. I'll probably pick up some from work. When I was looking, I forgot to pick them up. Tweezers are a good idea. However, if you're going to use tweezers for wound cleaning, there's something missing in this kit, which I'm going to explain right now, but I will talk about again later on. You need to be able to flush the wound with sterile saline, 0.9% saline solution, or even fresh water that's boiled and cooled down. You need to be able to squirt and actually get the material inside of the wound out before you treat the wound. And that includes any bit of debris. So tweezers are good for that, but if you're actually taking tweezers like I would be, mostly for, see, you can really pressurize this. I would use tweezers for Lyme disease. So I want a good pair of tweezers, right? I really want for that. But a general cheap pair of tweezers is good. Do not be satisfied with the plastic tweezers, they're garbage. If you have plastic tweezers in your first aid kit, keep them. Don't throw anything out, but get some good metal tweezers. Yeah. Anyway, so a selection of bandages. Yeah, I guess. Nice to have. And it does say butterfly bandages. Now, butterfly bandages can be made. You don't have to buy them. All they are, I'll show you this packet, is a bandage that is thin and designed to go over a gaping wound. So let's imagine that this old man's vein here is a gaping wound. I have my butterfly bandages, I open them up, I put them on either side of the wound, and I do this. And then I cut here and keep these, because waste is waste, right? You only need to be about ½ an inch to about 1 centimetre, 1.5 centimetres around the wound in terms of compression and sticking. You don't need to wrap around. You never wrap around anything. So yeah, that's, but you can actually cut bandage material and make your own. You can cut this and make these into butterfly bandages. No problem at all. And like I say, waste not, want not. It's not sterile, but in a grid down, this will now be useful. I won't put this in this kit. Now the last thing they say is a quick clotting agent, such as quick gauze, right? So everybody has these, they have Israeli bandages, which aren't the same thing, and they have these, they put these on, and they follow the directions, which you should know, memorize before you have to use this, because you'll be stressed. But you can get alternatives. So what you're looking for is any material, and this is a hospital supply, that actually will cause clots to form. So as I've said before, tampons are designed to wick blood away without causing clotting. So don't have tampons, and they don't have tampons. So that's their kit. Absolutely atrocious. totally don't like it. What did I come up with a list of missing things? Well, I came up with this list. Antibiotics. Antibiotics are a 2-week course of general broad spectrum antibiotics in any SHTF kit that you may be away from home for a period of time is worth considering. The number one killer will be disease in grit down, and you don't know what's happening in grit down or where it's going to happen or when it's going to happen. None of us do. So you might want to consider storing some antibiotics in the kit. If you are going to have the kit in the car, don't, because the extreme of temperature and for the tablets as well is going to actually destroy that. The other thing is, I said saline, sterile saline, right? However you have it in, have a couple of vials like this, or get some syringes even if you haven't got sterile ones. Make up a little bit of a salt solution, 0.9% is what you're looking for, but it's not critical. Or at least have a syringe that you can pull up boiled water that's cold or cool from, and then squirt, squirt, squirt. Absolutely essential for eye injuries, absolutely essential for any deep cut. The other one I suggested was a magnifying glass. So you can actually look in the wound and see little tiny bits of debris. Now everybody's focused on gunshots, gunshots, gunshots. That's why every clip-clop and your Israeli dressings. Soil, grass, bits of clothing, bone, fragments, metal fragments will all be inside the wound and deep and impacted in the wound in a gunshot. You've got to get all of them out, not some of them, all of them out, or they will get infected and they will lose their life or their limb. The other thing I keep in my home kit, which I'm not going to show you, is brandy. A little bottle of brandy. Brandy is absolutely excellent. You can pour it on a wound directly and it will help sterilize it. But the main reason I have it is if I want to re-sterilize metal instruments. You pour the brandy on, set fire to it, and it helps. But let's be honest here, boiling up a pan of water, putting the instruments in it and boiling them for 5 minutes and then letting it cool down and being careful how you touch it is actually going to be far more effective. What I actually keep the little bottle of brandy for is half of it for the patient, if I think they can drink, and half of it for me. You'll be stressed. Blades. Now they suggested razor blades in another packet, and I didn't think it was a great idea for that, and I still don't. I think it's dangerous. But a surgical scalpel, the plastic disposable ones, which you would boil and reheat and reuse in grit down, are actually a good idea because you may have to what they call debride the wound, which is actually cutting it open more to let it bleed more to get access to anything that's infected or in there, right? Can't leave anything in that's external to the body or they'll die. Big miss in this kit, I mean, you got a surgical nail brush for goodness sake, is eye dressings and an eye wash solution. Now you can use these for that, though it's not that easy, but you can. And you'll see one of my other kits I actually have a disposable which you would boil and clean and reuse eye dressing, eye wash thing. And that's actually a good idea. If you don't wear glasses, get clear glasses and wear them in the bush. And when you're doing any woodworking or any fencing, have eye protection on. It's really problematic if you get anything in the eye, especially in grit down, especially in first aid. Like I said, the little lollipop sticks are absolutely a great idea. If you've got some lollipop sticks, your kids have some lollipops, put them through the dishwasher, let them dry out thoroughly, put 4 or 5 of them in here, great for splinting fingers and toes. What's missing from this kit? The one thing that's missing from this kit that every first aider should have, because the priority in first aid, what's the first priority? Is it safe? Well, without gloves it isn't, is it? Where the heck are the gloves? Everybody has gloves. So what I generally carry, I do have disposable non-sterile ones, but I generally carry surgical disposable ones in my kits, just because I'm quite happy to shove my hands into your body and have a look around looking for bits. So when you open these, like anything, the inside's sterile, the outside is not. As soon as you've opened it, when you open it up, you have the glove. How do you put the glove on? You put it from the bottom, like this, not touching the outside of the glove, like this. Now this technically is actually sterile, so I would then use this as a sterile field, and you can adjust this, like this. Now these are really basic, cheap ones, right? But you can get into the wound with these quite easily. And I will show you in the next video proper gloves, which I also carry, which are actually surgical gloves which actually fit the hand, and I'll show you how to put them on, and I'll show you what I've got in my 2 kits. Now I've got a feeling I'm going to have to show you both kits separately in separate videos, So I'm sorry if this is boring you. What I would encourage you to do is ask any questions about anything I've said or anything you're questioning about what you might need in your first aid kits below in the comments. Like I said, you need to go to a doctor for doctor advice. I'm an RN. Don't take my word as medicine, because it is not, but I have a lot of practice in trauma, 3 decades of it now at this point, and I do kind of know what I'm talking about in terms of first aid, and I've actually used first aid quite a bit in various situations. So there you go. Don't be frightened about first aid. It's not complicated. What gets complicated is when you start buying stuff like this, and we'll get into that in the big kits. It can get really expensive for somebody who hasn't got access to first aid supplies very quickly, and yet it really doesn't need to be. It's basic, and it's a band-aid to get you to proper care. Now in Grit Down, you're going to be the proper care, but a first aid kit is not sufficient in Grit Down. You can buy the huge big army trauma packs, which are always useful if you've got the money, because even if you don't know how to use it, chances are there'll be some sort of a nurse or a doctor or a vet will show up and they can maybe help out. So like I said, I'm going to show my 2 kits, my hiking kayaking kit and my home kit, which isn't really my home kit. My home kit's in a huge box, but this is one I bought off the shelf just to see what was in it, and then added a few things to it, so it'll give you a better idea. But what are we going to do next week? Well, those 2 videos are coming up first, but next week I'm going to probably combine this, because it's going to take 4.5 years at my present rate. We're going to look at stop bleeding, disinfect a wound, bandage a wound, and probably deal with blood loss. I'm not going to get too much into most of this stuff because I've actually really well covered it, I think, on the Stop the Bleed videos, but there you go. Then the week after that, we're going to have some fun. We're going to get into bandaging and dealing with broken bones and severe issues. So that should all be fun. But just in case you're interested, the kit that's mostly developed from their book, with a few additives from me, will be a Gore Prize, and I will announce how we're going to do this at some point in one of the videos, so you have to watch them all. Gloves should always be on the outside or the top of all of your kits, right? Safety first. Anyway, toodles! And remember, in SHTF, if you don't prepare, tomorrow will always be worse than today. Toodles.